Hi, my name is Eli, and I'm a second-year transfer student at Seattle University. And I want to be a nurse because since I was little, I've had firsthand experience about the unique role that nurses have in humanizing patients and how healing they can be. And this inspired me to pursue nursing, and eventually I want to become a pediatric nurse. So I'm a nurse tech and I work in a pediatric ICU, and being able to walk through the cases in class was super helpful for my understanding, bringing it to work and vice versa. I feel like my work experience gave me more context for what we were learning, and then also being able to walk through case studies helped give me more context to be able to better make better sense of what I was seeing at work. I feel like it was a great supplemental learning opportunity to be able to walk through cases that I might be able to see at my job. And I feel like it really helped give me an edge at my work and also gave me more confidence to be able to jump in and help nurses, and then just confidence to be able to learn and ask questions as well. Yeah, I felt like working with the case studies was super helpful when I went to clinical, kind of like for heading into work. It really gave me the confidence to be able to interact and engage with both patients and healthcare providers. And it also gave me context, more importantly, to ask questions. Using the case studies in class and having some sort of reference to be able to compare what I'm seeing in my clinicals to what I'm learning in class, aside from just lecture, but actual case studies, what gave me the confidence and also helped me think about the kinds of questions that I should be asking nurses and providers while I'm at my clinicals. Focusing on the case studies meant that we were engaging more, first off, and that we were doing learning. We were doing more self-teach, which I feel like is super helpful, to be honest. It forced me to really look at my learning style and to come to class prepared. But then in class, while we were utilizing the case studies, it pushed us to be more collaborative and to rely on our classmates. I felt like, aside from like the learning benefits, I also felt like we had to find a place where we could be vulnerable to be wrong. And I felt like my experience was that I remember raising my hand many a times to try and answer questions, and I was wrong. And I think that in a stereotypical lecture setting, I would be really afraid to try and answer questions. But when we were focusing on a case study where the more important part is how are you thinking rather than the answer, that rather than coming up to the right answer, I feel like in general I felt safe, and to be able to ask questions and to engage in the learning that I wouldn't have been able to in a typical lecture setting.